will take your first exam. First exam, 50 items.
I think Monday, June 15.
June 15, Miss.
I'm sorry, June 15. I'm sorry.
15.
Yeah.
Okay, and on human error. Okay, thank you. All right, next one. Next, so 50 items. Aside from that, you can pass your assignment early. If you want to pass it now, you can pass today, but not necessarily today. You can pass between June 14 to 15 your first assignment. And the assignment are the following. Okay? So chapter what? Chapter
20, 13, 14, 15, 19.
Okay, very good, Mr. Alvaro. 14. Okay, so 13, 14, 15.
19.
15, 19.
19.
Well, that's it.
Yes.
Right?
No, 20?
Okay, yeah, it's 20 is here. Okay, so we're good?
Yes.
Good.
All right, next one. So that you will not ask your classmate, repetition in your in your text, right? And then regarding the what? Regarding the you call this the password in Zoom. You can just copy the password. It's in there. Okay, and then you can what? You can enter the password. All right. Okay. So when I send you the link of what? The link of Zoom. You just press that one or copy, and then as well as copy, separate the password. Okay. So the next one, next week, after your first exam, right? So after your first exam, but by the way, 5 p.m., 5 to 6 p.m., okay, you have to be in your Schoology, right? Schoology to what? To answer question. To answer the exam question. Okay? So you will receive a message coming from me. Right? I told you already. Saying that 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 50 items, and then you will what? You will answer like you are sending me or you're answering my message. Like text message. Do you know the text message, right? For example, I'm asking you, oh, where to buy the number 1, number 2? You answer me, where to buy, for example, where to buy Yakult, number 1, for example, Filipino store or Jewel. Where to buy this one, number 2, number 3. Just like sending me a message. Are you following me? So
Yes.
it will be 1 hour. Okay, 1 hour. Okay, I'll give you 1.5 hours.
All right.
Okay? So next, that's it. 5 p.m., I will just accept a what? One answer from 5 p.m. to 6:30. Now, so following direction is very important. If I told you Schoology, because the purpose of Schoology so that you have like a what? You have like quality assurance. We have like a record that you're doing an assignment, you're doing what? You're doing a question, a proof. You know, I don't want anybody, oh, you didn't follow the instruction. Oh, you just what? You're not really, LPN graduate, blah, blah, blah. So, on this particular Schoology, that's a proof, right? Proof that you what? You're sending your what? Assignment and test. Okay? Do not email me. Technically speaking, do not email to my personal email. Okay? Because usually in the other school, they will give you like your own email. Your own email. Actually, in the other school, you are not allowed to what? You are not allowed to use your own email too. It should be an school email. Okay, but again, different school has a different style. That's fine, right? Okay, so since we don't have an IT to monitor everything, right? So that's why your personal email is okay. But for security purposes, do not send me anything to my what? To my own email. Okay, very good. Next.
So,
Again.
Miss Mary Jane, can we
Yeah.
have a dry run and see how that thing is gonna work?
What's that?
Can you have a dry run with us to see how it's
Yeah,
gonna?
okay, we can do right now, later. But I already sent an example before. We shared the screen before, but we can do that one, no problem. Okay, for those who are new student, okay, listen to me and welcome. I saw Mr. Marco. Welcome, Mr. Marco. I'm looking for a star. Okay, star is here. Star. Star.
Sorry, not.
Star. Okay, because, okay. Okay, it's okay. Again, Marco, Mr. James or Mr. B, can you please accommodate Mr. Marco for your WhatsApp? Okay, for your WhatsApp. Okay, for the new student, right? Ask what to do to your classmate. We have a lot of what? We have a lot of material. Let's say Zoom. Okay, if you cannot follow the instruction coming from your classmate, you can what? You can rewind the Zoom. Okay, the Zoom meeting. Okay, again, for everybody again, on June 15, Monday, 5 p.m., you will have your first exam. You will have your first exam. All you have to do is go to the Schoology, right? Go to the Schoology. Some of you send me a message already. I received a message from Schoology, right? Okay. So clear. So 5 p.m. to 6:30 p.m., you will take your first exam. 6:30 p.m. Okay? So 50 question, and then all you have to do is just answer my question in Schoology. Okay, we will do the practice, don't worry. And then the next one, 5 p.m. to 6:30. Now, after 6:30, we will meet again at Zoom meeting to continue our lesson. Okay, what will be the lesson next week? So pretty much today, I will give you a review, right? But of course, today, I will try to what? I will try to finish the 37, 38, and 39. Okay, and the remaining chapter. Okay, let's see. I will not hold you too long today because I want you to concentrate with your ATI, with your assignment, because you will have a lot of assignment. You remember you have an assignment in ATI, right? Remember your assignment in ATI. Now, for the new student, please ask question to your classmate regarding the ATI. ATI. Okay, so you have to what? You have to screenshot your what? Your ATI result and then send it to me in the Schoology. But not right now. On Monday, either 14 or 15, period. Okay, so are we good? Yes or no?
Yes.
Okay, so we're good, right? Okay, so any question for now? Okay, so let's go to the good thing we are what? We are a little bit advanced. Okay, so advanced. So let's go to 37. Yeah, what is your question? 37, 38, 39. Because that's the easy one. And I will not hold you too long. Okay, so let's start. Okay, so let's start. So let's start with the 37. Oh, by the way, before I will start the 37, I will explain briefly what is hyperthyroidism and hypothyroidism. Okay? Do you have a pen and paper? Pen and
Yes.
paper. Okay, sorry for my drawing. Okay, now next one. So the first one is the hyperthyroidism.
Is that chapter 37?
Yeah.
Yeah.
Okay, hypothyroidism. Okay, hyperthyroidism. Okay, so that's the first one. Now, okay, so another one. So I simply, okay, hold on. I need a drawing. I call it what? The hyperthyroidism, I call it everything is up.
Yep.
Okay? Everything is up. Up. I need an arrow up. I need to draw something. Okay. So, okay. Maybe I'll do something. Okay. One more time. Okay, again. Oh, what's going on with this?
They were on your floor today?
Hmm?
They were on your floor today?
Mhm.
They ask anything?
Mhm.
Mostly the nurse.
I didn't even saw.
Hyperthyroid, again, everything is up. Okay. So just put arrow up. Arrow up. Okay? Everything is up. So make sure arrow up. What are you talking about? Arrow up. So meaning to say, start with the vital sign. Vital signs are up. Temperature, pulse, respiration, plus the BP. Okay? So the hyperthyroidism is up. Everything is up. Okay? Except, actually, I will tell you the except later. Okay? Everything is up except there is no menstruation. I call it what? Amenorrhea. Okay? Amenorrhea. Right? So that's one. So again, everything is up except there is no menstruation. Amenorrhea. Okay? Meaning to say there is no menstruation. Amenorrhea. So are you following me? Okay, now, when you say up, please mute your mic. This is very important. Vital sign TPR plus BP are up. Okay, aside from that, the patient is very irritable. Irritability. Okay, very irritability and paranoid. Paranoid. Paranoidal. Paranoid. Okay, this is favorite in NCLEX. It came out. They asked about the attitude of hyperthyroidism. So the answer will be what? Paranoid or irritability. Okay, next, proceed. Aside from irritability, GI motility is up. GI, do you know the GI motility, right?
Yeah.
So GI motility is up. So meaning to say, when you say GI motility, it can lead to diarrhea. Okay? So what to do with the diarrhea? What will you do? How you will deal with the diarrhea? Broth diet. Okay, what type of diet? Broth diet. What is that? Banana,
Right.
rice, very good. Apple, tea, and toast. Okay, for the diarrhea. You have to be careful. If they are not asking you about the diarrhea in hyperthyroidism, don't answer the broth diet. Don't answer that one. Are you following me?
Yeah.
Yes or no? Don't answer that one. So instead, the diet for what? The diet for hyperthyroidism is high calorie and high carbohydrate. Okay? Because the patient is all over the place. All over the place. Like an ADHD. I consider like what? ADHD, all over the place. Okay? We can give also in the form of finger foods. Finger foods. Okay, so are you following me?
Yes.
Aside from that one, the patient is what? The patient is complaining of I'm what? Hot. Okay? So what type of room? Aircon. Air conditioned room. This is additional only, my dear. Okay, next. Next one. Aside from that, the patient is having what? Exophthalmos here. Like a bulging eyes. Bulging eyes. Okay, we call it exophthalmos. Very good. Okay, what to do? Two things. If the patient is very shy to go out, I don't want to go out. You know, what will you do? What will you do? Sunglasses. Sunglasses. If the patient having a dry eyes, what to do?
Eye drops.
Okay, very good. Eye drops. Okay, this is common question. So this is an introduction who is the hyperthyroidism. Everything is up except there is no menstruation. Are you following me? Another hallmark sign of what? Of hyperthyroidism. That's why I'm dealing this one is the pulse rate. Pulse rate is what? Significant vital sign. So meaning to say tachycardia. Okay, so what to give? What medication to deal with for hyperthyroidism, for tachycardia? Olol, olol, olol. Olol, 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 or what? The
Beta blockers.
Very good.
Yeah.
Is that Mubu?
Yes, it's Mubu.
Okay, Mubu. Okay, long move, Miss Mubu. Okay, beta blockers. Olol, olol, olol. Okay, beta blockers. So this is the hallmark or the what? The significant vital sign will what? Will increase. They will increase anyway. TPRBP is increased. But this is the what? This is what? To monitor the pulse rate. You have to monitor everything, TPR plus BP. But this one is like a significant one. Are you following me? Yes or no?
Yes.
Okay, very good. Next. So I call it summertime. Later, I will draw summertime because the patient is wearing short and complaining of what?
Being hot.
I'm hot. Okay, are you following me? Next, what is the medication? Very easy. The medication for this one is SSKI. Okay, Lugol solution. Okay, Lugol solution about the dye. It's all about dye. Okay, what is the purpose? To decrease the what? The thyroid. Okay, to decrease the thyroid. Because the what? Thyroid gland is what? Producing an excessive what? Thyroid hormone to make the story short. Okay, are you following me? On the other side of the story. Okay, so this one is hypothyroidism. Hypothyroidism. Okay, everything is down. Okay, again, hyperthyroidism up except no menstruation. Hypothyroidism down. Okay, except there is a menstruation. And we call it menorrhagia. Okay, menorrhagia. There is a menstruation. Okay, correct me if I'm wrong with the spelling. Menorrhagia. There is a menstruation. Now, what to check? Vital sign, again, just reverse. Just reverse. So TPR plus BP is down. That's it. And then, of course, another thing, weight gain. Okay, by the way, the hyperthyroidism is weight loss. This one is weight gain. Okay, another one. There is no problem with hypo. Regarding with the attitude, there's no problem. By the way, for the hyperthyroidism, no roommate because there's problem in what? In attitude. Okay, irritability and paranoid, like crazy. Okay, so they are what? They are all over the place. Okay, hypo, that is fine. There is no problem in attitude. Okay, so how about the roommate? Yeah, the hypothyroidism can have a roommate. Next one, GI motility is what? Down. GI motility is what? Down. So we call it what?
Constipation.
Constipation. Very good. Just reverse. Constipation. What to give with the constipation? High
Yes.
fiber diet.
Foods.
Okay, very good. That's it. And of course, exercise. The patient is having a baldness. Okay? Hair growth, baldness. Okay? Hair growth, baldness. Okay, next one. Aside from that one, right? What else? Of course, the diet will be low. Low in what? Low in calorie
High fiber.
and high fiber diet, right? Low in calorie and low
carbohydrates.
in carbohydrate. Okay, the technique here, they will ask you what is the diet for hyper. Hyper is high calorie, high carbo. For hypo, low calorie, low carbo. But wait a minute, you have to be careful. If the patient hypothyroidism is having constipation, what will be the diet? Just focus on the constipation. High fiber diet. Wait a minute. If the hyperthyroidism is having what? Diarrhea. What will be the diet? Brat diet. Period. You have to be careful. Now, aside from that one, the patient will complain that I'm cold. Okay, cold. What to do? Warm or
Blankets.
what?
Blankets.
Extra blanket. Very good. Extra blanket. All right? And then aside from that, for hypothyroidism, okay. What will be the medication for hypothyroidism? Of course, the common is the levothyroxine or Synthroid. You have to give the Synthroid early in the morning. Early in the morning. Okay, without food. Without food. Okay, and you have to check the pulse rate because if the pulse rate is 100, okay, hold it and call the doctor. If the pulse rate is 100, hold it and call the doctor. Okay, are we good? Yes or no? And I called hypothyroidism as as winter time. Okay? Summertime, hyperthyroidism. Winter time, hypothyroidism. Period. That's why this chapter is very easy. Okay? But still, I will go over. Okay? So what is the medication again for hyperthyroidism? Common. SSKI, Lugol solution. How about hypothyroidism? Synthroid. Synthroid. That's it. Levothyroxine or Synthroid. Okay? Are we good? Can I erase this one?
So all I'm is
Without food, right?
do we give that with food or without food? It's Synthroid. Without food?
Without food.
Okay.
Because usually you will give before breakfast. 6 a.m. I told you before first meeting, Synthroid, Prazole, and glipizide is without food. Okay? And of course, some antacid. So are you following me? Yes or no?
Yeah.
Okay.
Yes.
So can I erase this one?
Yes.
Okay. So again, I call it what? Hold on. Okay, so again, hyperthyroidism, everything is down. Hyperthyroidism, I'm sorry, everything is
Up.
up.
Hi.
Okay, except amenorrhea. What is amenorrhea again?
No
Menstrual.
Menstrual.
No menstruation. Sorry
Menstruation.
for my, unwritten. Okay, now,
Oh my God.
hypothyroidism. Okay, hypothyroidism, everything is down.
Down.
Except
You do
there is
get
a menstruation.
There is a
Menstruation.
menstruation.
Menorrhagia. Okay? Menorrhagia.
Menorrhagia is excessive?
Excessive.
Yeah, okay.
In the other book, they're explaining that hypo can be with or without menstruation. But again, this is the thing. Hyperthyroidism, everything is up without menstruation. Hyper. Okay? And then, of course, this is hypo. Hypo. Okay? Okay, now next one. So I call the hyper as what? Summer. Sorry for my
Summer.
drawing. Yeah, I try to buy my own pencil, but I need to have a touch screen to do that. Okay, so this one is what? Summertime. Right? Summertime. So meaning to say the patient is wearing what? Wearing short.
Shorts.
Short. Right? Short. Then going what? Going around. Right? Going around. Very irritable. Summer time. And weight loss. Okay? The other one, I call it what? Sorry for my drawing.
Winter
Winter
time.
time. So wearing what? Pajama. Okay? Wearing pajama. And of
Weight
course,
gain,
weight gain.
Gain.
And baldness.
Baldness.
Again, that's why if you are telling me that I think I'm pregnant today, if you will go to your OB, the OB will not believe you right away. They will check your what? T3 and T4.
before.
And then TSH. Why? Because of this one. Are you following me?
Yeah.
They will
Yes.
not believe you right away. They will think maybe you have a hyper and hypo. Okay? Yes or no? By the way, hyper. T3 and T4 is what? Up.
Oh,
T3, T4, up.
So you
And
say
TSH is what? Down.
Down.
wow.
Okay? So write it down. So just memorize this one because it is a favorite in ATI or any exam. T3, T4 is up in hyperthyroidism. TSH is down. Hypo, just reverse. Just reverse. T3, T4 is what? T3 is T4 is what? Down. And TSH is up. Okay, that's it. End of the story. That's introduction. All right. All right. It's very easy. I love hyper and hypothyroidism because of my arrow up and arrow down. Okay, are we good?
Yes.
Okay, next
excuse me,
proceed.
one question. You said with
Dollars.
hyperthyroidism,
Mhm.
we have tachycardia, right?
Yeah, that is the hallmark sign, the tachycardia.
And then in hypothyroidism, are we going to have bradycardia?
Not really. Yes, there is. It's down, but not really the highlight of the yeah.
Okay.
Because usually in the disease process, they have a highlight to check for. So for the hyper, very significant that the pulse rate will go down. For hypo, it is still go down, but not really like obvious.
Oh, okay.
Okay? Not
Thank
really
you.
obvious. And like in Addison disease. In Addison disease, you have to check the BP. Very obvious hypotension, 911. So it depends on the disease process. Okay, next. I will
Excuse me,
go.
Ms. Chan.
Yeah.
Quick question.
Sure.
For the T3, T4, will that be found on a blood test? Or
Yeah,
where
blood test. The
Okay.
T3, T4, and TSH is just like a test. They will what? So for example, I think I'm pregnant. I will go to the OB. They will check also my blood test. Okay?
Okay.
My blood test not only for pregnancy, because pregnancy blood test, we call it one qualitative. Are you pregnant in blood test? Yes or no? And then the quantitative HCG. And then aside that is the T3, T4, TSH. It's a blood test. Okay? So clear? Yes or no? The good thing in America, it's very easy to what? It's very easy to what? To run the T3, T4, and TSH. Because before in the Philippines, we have to wait for a week. We have to wait, patient, and then run one time, big time. Okay, here in America, they can run. They have a lot of money of the reagents, right? But in the Philippines, we are waiting to what? To do the test. Okay, so we're good?
One
Alright,
question, Miss Mary Jane.
Okay, what's that?
The Sidroid is given in the morning without food, and then you need to check for pulse rate.
Yeah,
So you
because
will
I
not
call,
you
we
will
call
not give
it, hmm?
you will not give the Sidroid if the pulse rate is elevated or
Yeah,
low.
if the pulse rate is 100.
100
That's
more than
why I
100.
call it synthroid toxic tachycardia. Okay, so just
Okay,
like my,
thank you.
my like an not acronym, but like like a guide, right? Pulse
Okay,
rate.
ma'am.
Do not give it. For
More
the
than
digoxin, okay, we are in the pulse rate anyway. If the digoxin, you're giving a digoxin, right? You know the digoxin, increased contraction of the heart. So the pulse rate, you need to check the apical pulse. If the apical pulse is 60 or below, hold it and call the doctor.
60 below and more than 100, do not give the Sidroid.
Oh, no, 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 no. Listen to me. We're talking about pulse rate anyway. So I will tell you what's going on, what medication to check. For Synthroid, Synthroid or hypothyroidism, if you're giving Synthroid, right, check the pulse rate.
Pulse rate.
If the pulse rate is greater than 100,
Okay.
hold it and call the doctor. Okay? And then the other medication, since we are in the pulse rate anyway, digoxin for heart. Okay? If the pulse rate is 60 or below, hold it and call the doctor. Okay, so we're good. Yes or no? Since we are in the pulse rate anyway. Okay, next one. Let's go to 37, but I will not do word for word.
Okay, ma'am. Thank you. Thank you.
Okay, thank you. You're welcome. Okay, next. Okay, this is very easy. Okay, this is like the introduction, right? The introduction about for thyroid disease.
Okay.
Again, the thyroid disorder are only two. The good thing in endocrine, you have to know the gland. The gland is thyroid. So all you have to do, thyroid, hypo, hyper. In one gland in endocrine, all you have to do is what? Partner. Okay, what type of twin is that? The opposite. What type of twin? What do you call with the opposite?
Paternal.
The opposite twin, not the same. What type of twin is that?
Yeah,
What's that?
paternal. Paternal.
Okay,
twin.
paternal. So meaning to say they are opposite. Right? Hypo, hyper. Hypo, anything hypo, give it. Okay, hyper, remove it. Okay, let's okay, are you ready? Again, there's only two. Hypothyroidism, and hyperthyroidism. Okay? Hypothyroidism and hyperthyroidism. That's it. And then aside from that, aside from the thyroid, Hyperthyroidism, I will give you the answer. Hyper, what is the result? Increase T3, increase T4, decrease TSH. Hyperthyroidism. Okay, next. Hypothyroidism. Decrease T3, decrease T4, and increase TSH. Period. Don't dig it. Okay, because they will not ask that one too much. That's it. They will just ask you if you're dealing with hyperthyroidism, what is abnormal findings. Okay, you will give the result. That's it. End of the story. Okay? Next one. Hypo, everything is down. Everything is down. Right? So if you don't know what I'm talking about, the down, down.
Excuse me, Miss Mary J. Are you doing the slides or no?
Oh, I'm doing this slide.
Oh,
Okay,
nothing's
stop.
happening.
Yeah,
Oh,
it's not
nothing?
moving. Yeah,
Okay, hold on. Doing
sorry.
this slide.
Good call, James.
That's good.
So we don't have to repeat, right?
Because today I repeat 2 hours in the other school.
Oh,
Because,
wow.
yeah, I repeat. I don't have a choice. I repeat again. Okay? Because of the, I think the sound. The sound. Okay? So, okay. We're good? Everything is okay, right?
Yeah.
Okay, let's start from the beginning again. Okay, are you ready?
Yes.
Okay, again. Okay, I don't want the scenario this morning. I repeat the two hours what? Lecture. Okay? So the next one. Chapter 37 is thyroid disease. So the two are what? The hypo and the hyper. Okay? So again, two only. Hypo and hyper. I'm just repeating the information, right? I'm just repeating the information based on our what? Lesson today. So again, hypothyroidism, right? Everything is down. What will be the result? T3, T4 is down, TSH is up. Okay, very good. Now, hyperthyroidism. Everything is up. T3, T4 is up, TSH is down. Period. End of the story. Now, for hypothyroidism, the other name is mixed edema. Mixed edema. Okay? And aside from that, and of course, during adult life. Okay. And then aside from that, it's down. Okay? I will not what? I will not memorize. I will just put in my mind, hypo, down. Okay? End of the story. And then with menstruation. If you don't know the word down, start everything with the vital sound. Vital sign, TPR plus BP is down. Are you following me? Constipated, weight gain. Okay? Weight gain. Hyperthyroidism, everything is up. The other name of hyperthyroidism is what? Take note on this one. Graves' disease. Graves' disease. Okay, now the next one. What are the signs and symptoms of hyperthyroidism? Everything is up except amenorrhea. That's it. Okay, let me see. Which assessment findings suggest that a patient may have hyperthyroidism? So again, what is your key? Everything is up, right?
Weight loss.
Okay, so I will go to A.
A.
Because this is decrease, right? So weight loss. Okay, so letter A.
A.
Okay. This one, letter D, is a what? This is a distractor because of the exophthalmos. Okay, this is only a distractor. It's not a sunken. It's a bulging. Okay, bulging eyes. Okay, now, let's do it. What will be the treatment for hypo and hyper? Hyper, we have to give anti-thyroid. Hypo, we have to give a thyroid medication. Period. Are you following me? Yes or no?
Yes.
Right? Okay, that's it. I told you already. Now, hyperthyroidism, again, hyperthyroidism, I told you anything increase, remove it by surgery. And this is the name of the surgery for hyperthyroidism.
Thyroidectomy.
Okay, there you go. Okay, it can be subtotal or it can be what? The whole thyroid. Okay, thyroidectomy. For the thyroidectomy, write it down. Check for Shibostek sign or the hypocalcemia.
Yes.
Still reportable. I know that is fine. I know that is common. But again, is still reportable. Shibostek sign. Okay, so are we good? Okay, next. Again, what will be the nursing intervention for hypo? I told you already, right? I outlined already what to do. Of course, the nutrition is low calorie, high fiber diet, warm, quiet environment, and of course, thyroid replacement. The name of the thyroid replacement is levothyroxine or Synthroid. Period. Check the pulse rate early in the morning without food. If the pulse rate is 100 or up, hold it and call the doctor. Period. Okay? Are you following me? Yes or no? Okay.
Yes.
Yes? What's that? And if the patient is complaining of I'm cold, what will you do? Provide
Provide
what?
additional
Yeah,
blankets.
provide extra
Provide
blanket.
additional blankets.
That's it. Okay, if you listen to me to my outline, that's it. Nothing to worry about this one. Okay, now hyperthyroidism, everything is up. The treatment, cool environment, high calorie diet, avoid coffee because the patient is like an ADHD. Okay, avoid coffee. Laxative, the patient is suffering what? Diarrhea already. There you go. And you have to what? You have to place, write it down, trach set.
Yeah.
Trach set
At the
or
bedside.
suction
Suction, yeah.
machine or calcium, IV calcium in the bedside table. Okay? Because airway is a priority for hyper because of the pulse rate. Okay? Are you following me? Yes or no? Okay, let's, again, this is repetition. Again, thyroid replacement hormone. The name is Synthroid. The name is Synthroid. And in addition, do not give Synthroid together with warfarin, digoxin, estrogen, and cholecystyrene. Okay? So need increase dosage of anticoagulant and decrease dose of digoxin. Do not give the following or be careful in giving this medication. All right? Now, next one. For the digoxin, okay? So the digoxin, I will just do the separate one. Digoxin, write it down, to increase the contraction of the heart. Okay? Contraction of the heart. So pretty much, the digoxin is to increase the contraction of the heart. We have to be careful for what? To give to hypo and hyper. Right? Because I told you, it's what? It's all about pulse rate too. Okay, now, check the apical pulse before giving what? Digoxin. Apical pulse. Okay, why apical pulse? Why apical pulse? If the apical pulse is 60, hold it and call the doctor. Period. Are you following me?
Yes.
And then the next one, the anti-thyroid medication. What is the name? SSKI. Okay, Google solution. Anything about iodine?
Iodine,
Iodine, right? To decrease what? The thyroid gland. Okay, thyroid gland. Now, the drug interaction is lithium. Lithium carbonate. Lithium carbonate. Usually, the iodine is added to water and swallowed. Okay? And then another one, minimize exposure. Wear latex glove to administer or to dispose patient. Excreta or what? Like the bowel and bladder. Okay? And then follow the agency protocol regarding for radioactive waste disposal. Again, aside from the iodine, another class for what? Hyperthyroidism is the PTU and metimazole or tapazole. Again, iodine, SSKI, okay, PTU, tapazole is to treat hyperthyroidism. Okay? This is uses for a long term of hyperthyroidism. Again, the common and serious adverse effect is nephrotoxicity, hepatotoxicity. I don't want you to memorize the adverse and what? The side effects. In your PowerPoint, the word common effects. Okay, common adverse effect. That is a side effect. Usually look for GI. Okay, GI. I told you, right? The serious adverse effect, don't memorize. Look for what? Exaggerated scenario. Bleeding, airway, dyspnea, and toxicity. Okay, that is my style. I will not bother myself to memorize. That is my style in what? In looking for side effects and adverse effects. Okay? So, are you following me?
Yes.
Okay. Anybody from you can explain what is the medication for hypo and hyper on your own what way? Okay? Let Miss Melissa. In your own way. Okay? On your own understanding.
For hyperthyroidism, where the medication of choice is ulol beta blockers.
For the pulse rate only. Pulse rate. Pulse rate. But
then,
to treat the hyperthyroidism, what is the medication?
Hyper, it's
Hyper.
SSKI.
Very good. Very good. Very good. Again, be careful. To treat the pulse rate, okay, for the tachycardia, that's the ulol-ulol, ha? And then, but to treat the disease, what is the answer? You're right.
SSKI.
Yeah, very good. SSKI, Lugol solution, PTU, tapazole. Okay, very good. Thank you, Miss Melissa. How about the hypothyroidism, Miss Evelyn? Let's try, Miss Evelyn.
For the hyperthyroidism,
Hypo.
hyper would be the synthroid.
Okay, very good. And how to what? Before giving synthroid, what is your nursing consideration?
Check the pulse rate.
Pulse rate.
And if it's greater than 100, you have to hold it.
Okay, hold it.
And then you would have to give it in the mornings without food.
That's it. End of the story. Okay, so we're good? So I'm done with 37. Let's proceed with 38. This is easy. It so happened that your what? Your PowerPoint is separate, right? But actually, I have like a compiled notes for this one. Okay? For Pharma. I can share it with you after the Pharma. I'll give it to you. Okay, next. Did you see my screen?
Yes.
Okay, very good. Quality assurance because it happened in the morning. I repeat the 2 hours. 2 hours final recall. In NCLEX. Final recall. Okay? So this is easy. This is steroids. Okay? Steroids. Okay. Before anything else, let me check. What is the title for 39?
Corticosteroids.
No, the next
That says 38.
38.
How about the 39?
39 gonadal hair
Gonad.
hormones.
Ah, the
And
hormone.
hormones.
Okay. Before anything else, okay? The steroids, before anything else. Introduction to steroid. Okay? So, yeah, let me see. I want to share the screen again regarding the steroids. Okay. Write it down before anything else. What steroids is sugar. Okay? Steroids is sugar. So anything with hypo or lack of steroid or hyper or increase of steroids, you will be prone to infection. Okay? So why we need to take the steroids for only for a certain time? Sometimes 7 days to up to what? 10 days. Right? Maximum. Because it can lead to immunocompromise. And of course, another one, weight gain. Big time weight gain. Again, steroids is sugar. Okay? So now, you need to remember the two disorder regarding for steroids. By the way, steroids, okay, anti-inflammation. Anti-inflammation. For the bacteria, antibiotic. Okay? If you will encounter in the future itis, pericarditis, or what? The ending is with itis. You have to ask, is that bacteria?
no.
Okay?
Oh,
Inflammation.
Inflammation.
No. That's why I'm asking you either way. Because in any itis, either inflammation or infection. Of course, you need to know the disease process. Are you following me? Either way,
Yes.
if the cause is bacteria, we have to give what? Antibiotic. Okay, now, if the cause is inflammation, okay, we have to give steroids. Okay? So what will be the test for bacteria? Okay, to rule out bacteria, culture and sensitivity test. I want you to memorize this one. And how about for what? How about for inflammation? What is the test? ESR. Erythrocyte sedimentation rate. Memorize this one. I want you to memorize this information. Okay? So for the itis, any itis, pericarditis, nephritis, all the itis in the whole world, you have to ask, right, to etiology, either inflammation or infection. So are we good? Yes or no? Okay. If it is bacteria, give antibiotic. The test is culture and sensitivity test. If it is inflammation, steroid. ESR is the test. So we're good. Yes or no? Now let's talk about the what? The steroids. What condition? What is the particular condition to give steroids?
Lupus. Lupus.
What's that?
Lupus.
Lupus?
Lupus. Okay, yeah, lupus. Yeah, SLE or SLE, right? Okay, what else?
Or maybe for like Addison or Cushing disease.
What's that?
Addison disease and Cushing disease.
Okay, Addison, that's the time that you will give steroids. Very good. But the Cushing do not give steroid. Right? Addison, when you say, look at me, this one, D down. D down. Down of steroids. Are you following me? So everything is down in what? In Addison. Okay, what are you talking about? I told you, if you don't know what is the down, start with the vital sign. Temperature, pulse, respiration is down. But the hallmark or significant to watch for Addison is BP. Hypotension, airway is a priority. And this is a 911 scenario. If they are giving you Addison has a BP which is low, like 60/40, my God, that is a 911 because it can lead to Addisonian crisis and can lead to what? To something else. Right? That is a big 911 or reportable. Are you following me? Yes or no? And aside from that, right, the hallmark sign is dark pigmentation. Dark pigmentation. Okay, dark pigmentation. Because of what? The melanocyte stimulating hormone. Dark pigmentation. Are you following me?
Yes.
Okay, dark pigmentation because of the MSA. Okay, this is only a preview. So now, what will be the treatment for Addison? Steroids for life. Steroids for life. Okay, are you following me? Another thing, the patient, everything is down, but the potassium is up. Hyperkalemia. So, meaning to say, you have to watch out for arrhythmia. You have to be careful with this scenario. This is a big time 911. Okay? Because arrhythmia, heart. Okay? Arrhythmia. Hyperkalemia. Now, the magic words or the star of the show for Addison and Cushing disease is the potassium. What do you mean by potassium? Addison, everything is down except potassium is up. Are you following me? Yes or no? Right? It's very easy, right? Now, on the other side of the story, the Cushing disease. Cushing disease, here we go again. Cushing disease is what? Everything is up. Sugar and salt is up except hypokalemia. Who is the star of the show in Cushing? Potassium. Are you following me? So be careful. In your ATI, they will ask you what type of what? What type of food are you going to give or diet? In Addison, what type of food? What type of food? Aside from giving a high calorie and high carbohydrate.
Low
Low
potassium.
potassium.
There you go. How about in Cushing?
High potassium.
There you
Potassium.
go. Okay, be careful. The star of the show for Addison and Cushing is who? The potassium.
Potassium.
Okay, in hypo and hyperthyroidism, the star of the show is the menstruation. Are you following me? Yes or no?
Yes.
Okay, very good. So this is weight loss. This is weight gain, Cushing. And that's why over what? Over dosage of sugar or steroids can cause Cushing. Under dosage of what? Steroids can what? Can lead to Addison.
Addison.
That's it. Very simple. Actually, me, I will not memorize. Sugar, salt, Addison, everything is down except the potassium.
Potassium.
Okay, Cushing, everything is up except potassium. Treatment for Addison. Oh, of course, steroid. Treatment for Cushing. Okay, of course, diuretic. Okay, anything like dealing with fluid volume, you know, excess and fluid volume, fluids like weight gain and weight loss. Okay, we have to what? We have to deal with what? Either, especially with the excess, diuretic. Excess of fluid, diuretics. Okay, so we're good. Everybody? Okay, let's go right now to our main PowerPoint. Okay, so I'm doing a preview. Okay, so meaning to say you're doing steroids.
The treatment for Cushing is diuretics,
Diuretics.
but it's
But-
hypokalemia. So you give potassium sparing.
Very good, Mr. Ridolf. Aldactone. There you go.
Aldactone is
Congratulations.
the
Okay, potassium is sparing. So see,
diuretics
you're what?
is
You're developing your critical thinking. Be careful. That is the key in nursing. Okay, know the what? Know the main idea. Okay, are we good?
okay, ma'am.
Okay.
Thank you so much.
Did you see my screen?
Yes.
Okay, very good. Next one, this is very easy, steroids. Steroids, I have a clue. Everything that what? That ends with one. End with one. Beta-metasone. Okay? What else? Hydrocortisone.
Cortisone.
Yes? It's not?
Yeah, screen is not moving.
Oh, it's not moving. Okay. Hold on. Did you see my screen?
Yeah.
Okay.
They're not moving.
It's not moving. I'm not doing anything.
Okay.
Did you see my screen?
Yeah.
Thanks, Adira.
Of course not moving. I'm not doing anything. Okay, thank you. Okay, so are we good?
We're good.
Okay. Okay, so all right. Steroids is easy. One, inflammation, weight gain. Okay, and then prone to infection. That is my keywords for what? For steroids. Usually, we're giving steroids for the hyposecretion of adrenal gland, and we call it Addison disease. Addison disease. Okay? Addison disease. Now, we have what? Adrenal gland has what? Secrete two types of steroid. You remember in your med search, right? The mineral corticoids.
mineral.
Usually, this is like salt. The aldosterone, the what? The main thing for aldosterone is all about regarding BP. The glucocorticoids is the sugar. Okay, the one that ends with one. O-N-E. Cortisone, hydrocortisone, prednisone, all the son in the whole world. Okay, are you following me? 1, 1, 1, 1. Now, the beta-metasone is also. But the other one, triamcinolone, that is what? That is for the skin disorder. Okay? Now, how to assess? Okay, mute your mic. For the assessment, if we're going to give a what? A prednisone or steroids, we have to what? The doctor is very, very what? Very, very careful on that. Because there's a lot of complication. Weight gain, you will be prone for infection, so on and so forth. So we have to assess, check for electrolyte imbalances, potassium, sodium, calcium, chloride, so on and so forth. Check the INO. Again, tip. Anything about, okay, just listen to me. The signs and symptoms is leading to fluid volume excess and fluid volume deficit. Always check the three. Weight, INO, electrolytes. Write it down. Right? Anything leading with fluids problem. Right? This is a fluid problem like Cushing. Cushing is a fluid problem. Right? Anything like dehydration, ask yourself, is that a fluid problem? Okay, three things to assess. What are they? INO, weight, and electrolytes. Okay? And then, of course, check also for the previous treatment for ulcer, heartburn, stomach pain, and test for any bleeding. Occult blood. Write it down, the occult blood. Occult blood. Okay, for occult blood, we have to make sure or instruct the patient not to what? Not to eat a red meat and not to ascorbic acid because it will give a false positive result. Okay? A false positive result. Are you following me? Yes or no? A false positive result.
By eating
Your mic.
red
Red
meat
meat
also.
and iron.
Red meat. No, not iron. Ascorbic acid. Ascorbic
Ascorbic
acid.
acid and red meat gives
Red meat. Red meat. Red meat.
False result.
False results.
False positive result. False positive result.
For occult blood. Okay.
Okay. So again, false positive result. Okay? Next one. Another one. So we have to check for glucose. Glucose. If the patient is taking, right? Taking one steroids, monitor glucose. Okay? If we need to administer insulin, insulin may be required. Okay, just in case if the glucose will be very high. Okay, so clear, yes or no? Next one. Next one. Monitor weight gain. Monitor INO and monitor electrolytes. Okay, next. Let's go to the first class. The mineral corticoids. More on the sodium. More on the sodium. Under mineral corticoids, this is more on the sodium. Okay? Sodium. Now, fludrocortisone or 1 or florinef. Okay? So treatment for what disorder? Addison disease. Because for the Addison disease, not only a sugar problem, the main problem of Addison disease is the BP. Okay, again, what is mineral corticoids?
That's sodium.
Sodium. That's why also we have to administer to Addison because Addison is not only a sugar problem, it's also what? The BP. Are you following me? Yes or no? Okay, and then check for what? Sodium accumulation and potassium depletion. Again, everything is down except potassium. Now, next one. Okay, next one. Glucocorticoids. This one is a sugar. Okay, this is sugar. This is the sugar, meaning to say this is a treatment for Addison also and for other disorder. Okay? So this is anti-inflammatory. As I told you before, the steroid is anti-inflammatory and also anti-allergenic. That's why some of the dermatology or skin disorder, you have to take what? Steroids. Okay? Or immunosuppression for what? For a certain disorder like cancer, autoimmune, right? And organ transplant. For organ transplant, we have to make sure for any transplant, rejection is very bad. Rejection. We have to watch out for any rejection. So are you following me? Yes or no?
Yes.
Okay, very good. Now, what are the drug interaction for steroid? Okay? So diuretics. Do you know the diuretics? Diuretics, right?
Yes.
Okay, so write it down, the 5 types of diuretics. I'll just give you a preview for the diuretics. Okay, now, one more time. Diuretics, number 1.
Yes.
Group diuretics. Right? What is a loop? Again, just listen right now. It's all, I'm just doing a preview. Preview. Okay? So the number one is loop diuretics. What is loop diuretics? Okay. So meaning to say, when you say loop diuretics, that is potassium wasting. The best example is LASIK. LASIK. Loop, right? Did you understand? Yes or no? LASIK, right? Number two is what? Potassium sparing. Potassium sparing, give me an example. Aldactone or
Spironolactone.
spironolactone. Okay, number three is what? Hydrochlorothiazide or thiazide group. Hypokalemia. Okay, hypokalemia. Don't worry. In the diuretics medication, I will dig it. Okay? And then the number 4 for ICP. ICP is mannitol. ICP meaning to say brain. And then IOP, eyes. Diamox. So we have a 5. Diuretics. Okay? Are we good?
ICP, intracranial pressure.
Yeah. Brain. Intracranial pressure.
That's mannitol.
Right? Mannitol.
And
Mannitol.
which one was for the IOP?
IOP, diamox. Like a diamond. Diamox. Diamox. D-I-A-M-O. Like diamox. Okay, so we're good.
Yeah.
I'm just doing a preview. Next. So again, diuretics. Steroid may enhance the loss of potassium. Now, warfarin. This is what? Anticoagulant to prevent future clot. What are the example? Warfarin, sodium, or coumadin. What is the antidote of warfarin, sodium, or coumadin? Vitamin K.
Vitamin K.
Very good. Or aqua mepyton. Aqua, like aqua, water. And then mepyton, M-E-P-H-Y-T-O-N. Aqua mepyton. Okay, so are we good? Next, proceed. Next one is what? Oral hypoglycemic agent or insulin. Diabetic, pre-diabetic must be monitored for hyperglycemia. Okay, because if you're giving a steroid and the patient is already diabetic, we have to monitor the blood sugar. Are you following me? If they will ask you what are the drug interaction for steroid, diuretics, warfarin, and hypoglycemic agent. Are you following me? Yes or no?
Yes.
Okay, very good. Next, what is steroid taper? Abrupt discontinuation of therapy may result in adrenal insufficiency. Again, as I told you, I don't know if I told this group, do not stop any medication abruptly. It's a negative intervention. Okay, do not. We need a doctor's order. Anything that you stop can lead to some complication. So are you following me? Yes or no? Okay, so steroid taper is what? Abrupt discontinuation of therapy may result in adrenal insufficiency. Okay, symptoms of that like a withdrawal. You know the withdrawal, right? When you stop, even Coke. When I stop the Coke, I have a headache. You know, I'm not feeling well. So we have to be careful, like a withdrawal. So symptoms, fever, malaise, fatigue, weakness, dizziness, anorexia, nausea, hypotension, do not memorize. So when you stop something, what will happen to you? Like a withdrawal, right? You will not feeling well. Fatigue, weakness, fever, so on and so forth. Are you following me?
So you need a
What's that?
doctor's order, right, to stop.
Oh yeah, to
medication.
stop. Okay, if we need to stop, we need a doctor's order. Because of anything, withdrawal is a big thing. Withdrawal. Okay? Next, steroid. Use with caution. Again, diabetes mellitus, of course. heart failure, hypertension, right? Because of the what? Mineral corticoids, right? The BP is already high for the hypertension. Peptic ulcer, mental disturbances, and suspected infection, right? Again, if the patient is taking one, the steroid, ONE, what is your education? Contact healthcare provider if you want to stop. Okay? What? The medication.
Medication.
Make sure skincare because they are prone to infection.
Infection.
And then also stress. Cope with stress. And then proper nutrition because if they are taking steroid, do not give a what? A high sugar content, right? And of course, regular exercise. And of course, record everything, right? Again, what is the common adverse effect of steroid?
Hypoglycemia.
D.
Anti-inflammation.
D.
Not hypoglycemia. Because the
Should be
steroid,
hyper.
it should be hyper.
Hyper.
Right, because it's a sugar. This
I think
is
it's
a
D.
sugar. Okay, D. Okay, let's another question. Let me see. Miss Yadir.
Yari.
Yari.
Going. The nurse is teaching a patient about a glucocorticoid medication to treat an adrenal disorder. Which statement by the patient indicates a need for further teaching? Let's see.
A negative, right?
C.
What's that? Letter what?
C.
Boy.
Further teaching. Negative.
I think it's C.
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 C. Yeah.
Yeah.
Because this one, even you don't know.
Because you can't.
No, you can't.
90%
Stop the medication.
Next week.
Like
Next
stopping
week.
the medication, yeah.
Meaning to say, you will
C.
know next week,
Yeah,
right?
because next week is too far, so you have to just refill it.
Yeah, stopping the medication.
Very good.
Yeah. Refill it immediately.
All right. Okay, next, let's see. Let's see Miss Mika. Mika, can you please try this one?
Okay. A patient has been taking oral corticosteroid to treat inflammation of respiratory tract. The patient questions the nurse who is administering a dose of insulin. The nurse should respond. Physician, the pancreas is no longer functioning. Insulin in your respiratory tract has caused you to be diabetic. Typically can cause blood sugar to increase. D?
Letter D.
Yeah. D.
Okay, did you agree?
That's right.
Yes.
Yes.
Because again, it's sugar.
Sugar,
Okay?
sugar, sugar.
Sugar, period. Okay, thank you. That's it. That is the key. Sometimes you have to have a key. Right, end of the story. All right?
Yeah.
Okay, so see, now, okay, let me see one more before we will do the review. And then at the end of the pharmacology, I have an outline in pharmacology. So I will outline everything, right? I will outline everything. Okay, but by the way, I'll give you like a okay, come back at 5 minutes, 6:35.
Okay.
6:35, take a bladder break. Bladder break.
Bladder break.
Bladder break.
You want to go heat up something?
She's fun.
So John, you're gonna take the thing?
Yeah, I'm gonna look into it.
Yeah.
Hopefully.
The one I sent you is cheap because
I'm muted.
your Tita Girlie's going to do it.
Yeah, I'll join her. Fuck yeah.
July.
I'm joining with her.
You know.
I'll just I'll throw it. I'm gonna shoot like this.
You know, there's a. It's kind of weird the way the other when the class they teach you that
Yeah.
You have to hold it in a different way, you know?
Yeah.
So they teach you the right way the first time. So,
Yeah.
but yeah, it's not even 16 hours. It's only, I think, minus the 4 hours, not 2 hours. I mean, so it's only like 14 hours. But Saturday, Sunday. So
14
9
hours.
a.m.
Oh,
9
so they
a.m.
split it up in like 8 or 6 or 7, 7 and 7. Yeah.
Yeah, yeah. But the first
Okay.
day, I think you do the target shooting. So
Ah.
yeah, after the class, you go to the gun range, and then they do that.
Mm-hmm. Oh, okay. Yeah, because I'm different. Everybody is like right eye dominant. I'm left eye dominant
Oh, you
because
are?
I've
Okay.
because I've taken all because of my years in Muay Thai and
Uh-huh.
boxing. Since my stance is here, this is I'm leading with that hand. I'm used to having that. I'm used to
The
having
left
my
eye,
eye.
right? The left
Yeah,
eyes are leading. Okay.
my left eye is leading because I tested it myself because you know how you do that triangle test
Yeah.
and you do that and then if it doesn't the other thing doesn't show up on the
Uh-huh.
other eye, that means the first eye that you can see through the triangle is your dominant eye. So I did that. Yeah.
At least
So
you got still have your eyes, man. When you do your Muay
hmm oh man, like it's not so in boxing. I need it more because I used to take lessons
Uh-huh.
with an undefeated pro boxer, and we sparred a
Uh-huh.
lot, and he whooped my ass. So I used to
You still do
he
the
would.
class? You still doing?
Oh, me? No, not anymore. Not ever since this. I kind of stopped because I'm trying to prioritize this first.
Uh-huh.
But
Good. Good.
at the same, but like I don't want to like I've learned so much that I don't kind of like want to just sharpen it up. So luckily, a pro fighter asked me to train him in Muay Thai
Uh-huh.
for his upcoming fight. So I basically became his Muay Thai coach.
Good.
So
Good. Is
yeah.
he fighting in Chicago or?
He fights out of Chicago. He
Chicago?
fought. He actually had a fight last time, and
Did he win?
then yeah, he won. He whooped his ass. Jesus Christ, it wasn't even close. We we made me and him made up the game plan for the most part.
Oh.
Yeah, because he's a MMA fighter, but with a decorated Muay Thai background.
Okay.
So his first love is Muay Thai.
Does he
So
do
that's
any other like jujitsu or
oh
any
yeah.
other
Yeah,
self-defense
he loves Muay Thai, but he's actually submitted two people twice. I mean, two people
Mhm.
in fights
I
in a
see.
fight before. Yeah, with I think with a guillotine and with yeah, I think it was all just guillotines, guillotines and a rear naked. Like so, you just put him in a headlock, pretty much, and he's just cranking up in the neck like that. So he does that. I want to do
I'll call you
C-lock.
right back, John.
Huh?
I'll call you right back. Hold
Okay,
on.
no worries. No worries. Alexa, play Rack's Too Skinny by Migos.
Rags Too Skinny by Migos from Spotify.
Sorry, John.
Hello, class. Where is the assignment box?
The what?
You know, when you're submitting the assignment, you know, it used to be like assignment box on the side that it
No.
does not.
Oh, you just
We
send
don't
it.
have it here.
Yeah, you just send it through the Schoology message.
Yeah.
Well,
It's like an email. It's like an
Yeah,
email, right?
just send it like
Yeah.
if you were sending her a personal message.
Mm-hmm.
Yeah. Under her name, though.
Yeah, that's why.
It'll come up when you type her
Type
name. It
in
will come up.
Maria or something like that.
Mary Jane.
Oh.
No,
Mary
but she has a
Jane.
different name on here, John.
Oh, she responded to me and I turned it in. She was like, "Okay, Yadira,
No.
get out of here, bro."
It's not
Whatever.
Yadira. It's
Whatever.
Yeah, yeah, big, yeah, like this. Hey, fun fact, guys, me and Yadira used to be neighbors.
Oh yeah.
Thank you.
Yeah, we used to be neighbors. We from the same block.
Estrogen, progestins, prototype, conjugated estrogen. What? Yeah, where's Jay?
Yo, what's up? What up?
What up?
Jay, you're so quiet. Mineralog corecoids.
Between my legs.
Can we use a medical term for
Testicles.
since we're all there you go. That's a legal term. What? What?
Well, you want to see it, B? My camera don't work, man.
Must have been the steroids.
We don't need to see that right now.
Yep, atherosclerosis.
Inject steroids in your meatus.
So are we doing a study at Charmaine's house? Yeah. Charmaine, we're going to your house, Charmaine.
Randolph.
Hi, Sherry, how are you?
The thing that we should do on the ATI, it is pharmacology made easy 3.0.
Yeah.
Yes. Yeah, that's it. That's it.
All right.
Say it again. Say that again.
Oh yeah.
So we're gonna do all of this.
Is there a study session?
Harry, say that again.
Yeah, the syllabus.
Yeah.
The syllabus, all you have to do, you will check the syllabus.
Okay.
Okay, for the ATI.
Okay.
Right?
Yeah.
All right. So let's move on. The last is chapter 39. Okay, 39. But before I will go to 39, I already, prepare this one. The 39 is all about hormone. Okay, estrogen and progesterone. Estrogen and progesterone is a female, right? Female hormone. And the androgen is for male. Now, the estrogen, and progesterone, sometimes it's given, we have to ask if you are in the high risk of pregnancy, right? To maintain a safe pregnancy, right? The progesterone. And again, also, if you will undergo an in vitro, do you know the in vitro? In vitro, usually, the injection that they will give it to you is what? Estrogen and progesterone only. Sometimes suppository injection. And then, of course, the embryo, right? And then they will insert to your uterus. That's why I have a joke. Why I will do a $30,000 procedure? Because it's the same. Why don't you what? I just need the injection and then you do the natural. It's not 30,000. Because if you will do the whole process, it's the 30,000, right? Okay, just kidding. But again, estrogen and progesterone. Okay, now, this is the prototype, meaning to say the name. Take note. Okay, the name is the Premarin. Premarin, the brand name. Or conjugated estrogen. And then the other one can be what? This is another brand name. Bestron or Estron. And the other one is estradiol or estrase. Okay? Or the other one, the third one will be the DES. Okay? You can take a picture if you want. Next, the indication for this medication is for prostate cancer. Right? Write it down, the BPH. BPH. What is the BPH herbal medication? So palmetto. So palmetto.
What is it?
Saw palmetto.
Yeah. Okay, this one. Actually, there's a research that the saw palmetto together with what's the name? Amino acid, yeah, and hyaluronic acid. Okay, according to the research from the dermatologist. So palmetto together with amino acid and the hyaluronic acid is anti-aging. Okay, you see, not only for BPH. So palmetto is for BPH. Okay, next one. What will be the adverse effect? I already outlined for you. For estrogen, adverse effect, of course, look for like exaggeration. Okay, I know that's why I don't want to undergo the in vitro because of the injection, because according to the study, it can lead to cancer too. Okay, the medication, estrogen, progesterone, can what? Can lead to cancer. Okay, and then progesterone, it can be what? Risk for bleeding or thromboembolism. Now, what is the nursing consideration? Mix estrogen or progesterone prior to IM injection by rolling vials between palms. Okay? And then aside from that, monitor the BP and teach the patient, female patient, for right regarding breast self-examination and regular follow-up to detect the what? Risk for any cancer. Okay, take a picture. This is like an outline. Estrogen and progesterone. Estrogen and progesterone. Okay, so we're good. All right. So I will clear the skin. Is that okay?
Yeah.
Okay, now let's go to the main thing, the last topic for today. And then I will do the review. Okay. This is easy. This is very short. Did you see my screen? Yes or no?
Yes.
Okay, chapter 39. Did you see my screen?
Yes.
Yes.
Okay, so again, this is very, very easy. Right? Chapter 39, it's all about how to identify the use of estrogen and progesterone. I told you already. This is for what? Female hormone. Okay? So that's it. Now, just to explain, testosterone is for male sex organ.
It's not
Androgen
moving.
is for male. What's
Not
that?
moving.
The
Yes,
screen is not.
The PowerPoint's not moving.
Oh, it's not moving. Okay. Did you see the PowerPoint?
No.
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 Okay. How about this one?
Yeah, it's okay.
It's the
Okay.
same. I don't think it's gonna move.
Do you see
about this
the?
one?
Do you
Oh,
see that? Oh, there you go.
Yeah, there you
Okay,
go.
I will do
okay.
this one. I will not download. Okay. So again, just listen to me. Again, for this chapter, it's all about what? Estrogen and progesterone. I told you the outline. But again, just to give you a brief summary regarding the hormones, testosterone male, androgen male, estrogen, progesterone female. That's it. End of the story. Okay? Now, patient education. So usually, if the patient is taking, like a hormone medication, we have to be careful. Right? Like, I compare this one if the patient is taking steroid. Right? So, we have to be careful. Discuss the expectation of therapy. And of course, medication adherence and compliance are very important. Okay? And then, of course, so make sure that the patient are aware for the signs and symptoms. Okay? And then the baseline assessment to track the response to drug therapy. If the purpose of the estrogen and progesterone is what? Infertility, right? Meaning to say the patient needs to what? Needs to comply, needs to go to the clinic, outpatient clinic every day for injection, right? That is a little bit stressful, right? A little bit stressful because every day, right? So it depends. What is the action of that particular hormone? Okay, now, estrogen. What is estrogen again? For female. Female. Right? So, technically speaking, estrogen is affect the release of gonadotropin that cause capillary and fluid retention and also inhibit ovulation and postpartum breast engorgement. Okay, so you have to take what is that? What is the other name when you say birth control what? Birth control pills. Okay, birth control pills. Okay, birth control. So inhibit ovulation. But the other uses of hormone are what? Of course, that's another story. Like what? Like if you will undergo some infertility treatment. Okay? But birth control to inhibit ovulation and postpartum breast engorgement. So uses. You can use if you are the menopause what age, right? To relieve the hot flashes. And sometimes also the birth control, right? For example, another one to treat osteoporosis too. Okay, it depends on what's going on with you. Sometimes they will give you that one if you have a what? If you have a molar pregnancy. Do you know the molar pregnancy? Fake pregnancy. Meaning to say a grape-like instead of what? You are positive for what? For the test. So presumptive and what? Presumptive and probable. Meaning to say you are positive, you are what? Pregnant by test. But there is no ultrasound recognition. Instead, a lump or grape-like structure. And we call it what? Fake pregnancy. So, in that case, we have to remove it. Okay, the molar pregnancy, we have to remove it. And then for a year, you cannot be pregnant. They will give you also this medication, the birth control. Not only to control, not only for pregnancy, but also, write it down, for what? For the uterus contraction, to contract the uterus. So it depends. You will go to the doctor. You have to know what is the indication of the medication, because sometimes we can give this medication like the anticonvulsant, we can give Tumanic, and then same time anticonvulsant. Okay, be careful. Know what is the use of that medication or know the diagnosis of medication. Are you following me? Yes or no? And also, this is also uses to what? To slow the disease process of the cancer. Okay? Okay. So now I know they are using to slow the disease process of what? BPH and breast cancer. Okay? Now, again, therapeutic outcome. Therapeutic outcome, contraception. That's why we call it what? Birth control. Birth control. And sometimes, I'm telling you, lessen severe acne in female. So it depends on what's going on with you. If you have a lot of acne, right? If you have a lot of acne, maybe the what? The doctor can prescribe this medication. All right? So, know that one. And common adverse effect is headache, migraine, insomnia, weight gain, right? Birth control. And serious adverse effect is thrombophlebitis, right? Hyperglycemia, bleeding, and hypertension. Okay? So the next one, which is not used for well, I will not deal with this one. Next, progesterone. Progesterone, again, is to inhibit the secretion of pituitary gonadotropin or inhibit ovulation. To treat, again, the secondary amenorrhea. Amenorrhea, you know what is amenorrhea, right?
Yeah.
What is amenorrhea?
Absence of menstruation.
Okay, no menstruation. So sometimes they will give you what? Progesterone, right? Or breakthrough bleeding, endometriosis, or for contraception. Okay, because if you have a signs and symptoms of amenorrhea, meaning to say you don't have menstruation, right? So sometimes they will give you what? A birth control what? Pill. Right? Very good. And of course, same with what? I'm telling you, same with prednisone, the sugar, the steroid. weight gain. I compare the two, the side effects, weight gain. And of course, prone to any infection, but more on the weight gain. Okay? And serious adverse effect is more on what? On the jaundice, okay, liver, and mental depression. Okay, next. I'm done with what? Progesterone and estrogen. Right? The name of that, I already, what? I already share with everybody through the, what? Through the whiteboard. Okay? Because your PowerPoint is what? They didn't discuss the name. Okay, next. Androgen. Androgen is for what? Male sex hormone. For male. Okay? So they will give you the androgen medication to treat what? Treat hypogonadism, androgen deficiency, right? Any breast cancer, right? And a certain type of cancer. Androgen. Common adverse effect, gastric irritation, and serious adverse effect, electrolyte imbalances. And of course, masculinization and hepatotoxicity. Again, do not what? Dig this chapter. This is very easy, right?
That's it. That's it.
That's it.
That's it.
Yeah. So I already what? Gave you this one. All you have to do is take a picture, right? That's it. End of the story. This is a very easy
Simon?
chapter.
Yeah.
All right. So we're good. Now, if you're ready, I will do the what? I will not hold you too long because you have a lot of assignment. I will what? I will deal with the study guide. Okay. Study guide.
Study.
Okay. So I will go to your Ecology again. Again, by the way, for the ATI again, if you're what? You are confused. Always look for the what? Go to the syllabus. Okay, again, this is your assignment, right?
Yeah.
Yes.
This one. All right, this part. Okay, and then the remaining will be next week. At least, you know, we are advanced, done late. Okay, next. PowerPoint. Okay, are you ready? Okay,
Yes.
study guide. What will I do? I will pinpoint. If you listen to me during my discussion, the question is nothing. Okay, very, very easy. Okay, chapter 20. Okay, are you ready? So in the chapter 20, I will do so that everybody will not be confused. You will not, you know, you will not